Dr Sharkawy, what worries you the most about the way that we're seeing the COVID-19 outbreak unfold?
I think originally we were concerned mostly related to people who had traveled to so-called hotspots, particularly in China. And when there was a clear-cut travel history, I think we had some degree of anticipation around where cases could emerge and how quickly they could spread. Now we're seeing instances of what we call local spread from people who don't have an obvious travel history or exposure to someone who did, and I think that that's certainly troubling. And it speaks to the importance to remain extremely vigilant wherever we are about health practices, health hygiene, and hand hygiene in particular.
What about the way this is playing out socially and the kinds of behaviours we're seeing, the stockpiling and so on?
I think that whenever you're faced with a threat, the approach to resolving the situation is not one of panic. It's not one of extreme fear. I don't think that that guides good decision making, and I think it perpetuates more of the same. And when you see people stockpiling everything from N95 masks to toilet paper and hoarding those supplies, I don't think that that sends out the right message. I don't think it contextualizes the threat of the coronavirus as it properly should be. And again, it perpetuates a culture of fear, which I don't think is generally helpful.
And why do you think we're seeing that kind of behaviour?
I think there are a number of reasons for it, and I think that living in the information age provides us with a wonderful opportunity to share knowledge and to share helpful information. Unfortunately, it also provides an opportunity to share all kinds of speculation, inaccurate forecasting, and sensationalism, and it allows people to become empowered as so-called experts in any given field when they have very little credibility to back their beliefs with. And unfortunately, when you see YouTube videos of people falling down dramatically, and you see irrational claims of the lethality of this virus and what it's going to do, and you have people fixating upon numbers that continue to grow without really focusing on what you can actually do in your own homes and in your own communities to combat this in a rational and common sense way, you're going to see troubling behavior emerge, and it's going to spread.
What do you think is the antidote to that spread of misinformation?
I think the antidote is doing exactly what we're doing now, is trying to spread a message that is hopefully more constructive and pragmatic. And everybody that I speak to, I really try and simplify things to what you can do in your own home in terms of hand hygiene, washing your hands as regularly as possible, and keeping a level head about the fact that you can prevent the transmission of not only this virus, but a number of other infectious agents by demonstrating those good health practices and those good hygiene habits. That's really going to make a tremendous impact at the end of this. I really believe that that's going to break the chain of transmission and hopefully resolve this pandemic.
Dr Abdu Sharkawy, thank you very much for joining us today.
Thank you.
Hi, I'm Leigh Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.